Welcome to Hersing University NU 640, Introduction to Women's Health Across the Lifespan. This video will build upon Unit 2 and will discuss the remaining sections of Chapters 8, 9, and 10, Young, Midlife, and Older Women's Health, along with Chapters 12 through 14 from your Alexander and Colleagues textbook. This discussion will serve as a brief overview of the material. Therefore, I would like to ask that you please read the chapter for additional and required information. Additionally, I would like for you to review all other required and supplemental resources. This lecture will be presented by myself and Dr. Alicia Sutton.
In part 2, we will discuss secondary prevention a little more in depth here, since all of our screening guidelines fall under this, and then we're going to dive into the driving forces of care. In secondary prevention, you are basically looking for trouble. So the first secondary prevention principle that I want to look at answers the question, when do we do secondary prevention? First, the prevalence of the disease is sufficient enough to justify the screening. For example, can men get breast cancer? Absolutely they can. However, the occurrence is rare, therefore mammography is not a routine recommendation for men. But we do routine mammography on women, right? Because the prevalence is high enough to indicate the need. Another secondary prevention principle is if the health problem has significant effect on quality and/or the quantity of life. Target diseases for secondary prevention include hypertension, type 2 diabetes, dyslipidemia, and certain cancers. The third principle of secondary prevention is the target disease has a long asymptomatic period and the natural history of the disease is unknown. So what do I mean by a natural history of the disease? It is how a disease unfolds without intervention. So we know that treatment is available for the target disease, and providing treatment will alter the disease's natural history. I've always heard of the example of hypertension. In the 1920s and 1930s, hypertension was not treated and therefore led to renal failure and death. Now recall that back then there was very little intervention and certainly no dialysis. So in other words, the natural history of high blood pressure without treatment is that you'll likely die young of renal disease. Now we know that we can treat it and protect the kidneys, so renal failure is far less common than it used to be. Secondary prevention should also be a population acceptable screening test that is available and safe, moderate cost, and have reasonable sensitivity and specificity. Know that population acceptability will vary dramatically. For example, colonoscopies. I don't think anyone looks forward to having a colonoscopy test. Women aren't crazy about having mammograms done either. But compared to the alternative of contracting one of those illnesses and having it be unknown leads to the acceptability being very well. So let's take a look at some common women's health evidence-based guidelines. Let's begin with breast cancer detection guidelines. According to the American Cancer Society, breast self-exams is an option for women starting in their 20s. Beginning in their 20s, women should be told about the benefits and limitations of breast self-exams. In regard to the clinical breast exam, women in their 20s and 30s should have at least one every 3 years. Asymptomatic women greater than 40 should have one annually. Women ages 40 to 44 should have the choice to start annual breast cancer screening with mammograms if they wish to do so, and begin annual mammography at age 45 to 54 years. Women 55 years and older should switch to mammograms every 2 years, or they can continue yearly screenings.
Very similar to the American Cancer Society guidelines, ACOG states that women 40 years and older should have annual screening mammography. All women ages 40 and older should have clinical breast exams annually as part of their physical exam, while women ages 20 to 39 years should have a clinical breast exam every 1 to 3 years. The U.S. Preventative Services Task Force recommends every other year screening for women aged 40 through 74. It is important to note that they are against teaching self-breast exams and conclude the current evidence is insufficient to assess the additional benefits or harms of clinical breast exams beyond screening mammography.
The Breast Cancer Screening Guidelines for Women chart compares recommendations from a variety of organizations. We will focus on the American Cancer Society, the U.S. Preventative Services Task Force, and the American College of Obstetricians and Gynecologists, or ACOG. I have provided this document under the Required Resources modules. It is published by the Centers for Disease Control and Prevention, or CDC, and it will depict for you the breast cancer screening guidelines. Moving on to cervical cancer guidelines. Some important notes regarding the American Cancer Society's recommendations are as follows. Cervical cancer screening should begin at age 21 years regardless of sexual history. That's very important. Regardless of their sexual history, it should begin at 21 years of age. They recommend that women from ages 21 to 29 be screened every 3 years by a Pap test only. No HPV testing in this age group unless there is a negative Pap result. Women aged 30 to 65 should have both tests every 5 years. The American Cancer Society also recommends against screening women aged 65 and older and those who have had adequate negative cytology results. Again, ACOG has similar recommendations. Some important notes regarding their recommendations about cervical cancer screenings are: cervical cancer screenings, again, should begin at age 21, regardless of a sexual history. ACOG recommends that women from ages 21 to 29 be screened every 3 years using either the standard Pap or a liquid-based cytology. Women aged 30 and older who have had 3 consecutive negative cervical cytology test results may be screened once every 3 years. And ACOG recommends against screening women aged 65 and older and those who have had adequate negative cytology results. The task force is also very similar in their recommendations to the American Cancer Society and ACOG. In the same manner, I have provided you with the CDC's cervical cancer screening guidelines comparison chart under the Required Resources module. Okay, let's take a moment and discuss the colorectal cancer screening guidelines. The American Cancer Society now recommends that women with an average risk begin colorectal screenings at the age of 45 instead of 50. This can be done either with a fecal occult test or a colonoscopy. The fecal occult test is to be completed annually, and the colonoscopy should be done every 10 years. Lastly, I'd like to discuss endometrial screening. The American Cancer Society recommends that all menopausal women be educated about symptoms of endometrial cancer. For women who have hereditary non-polyp colon cancer, annual screening should be offered for endometrial cancer with endometrial biopsy beginning at age 35 years. In addition, any postmenopausal bleeding should be evaluated with a transvaginal ultrasound and/or endometrial biopsy. Next, I would like to draw your attention to a wonderful resource regarding well woman visits. ACOG now offers a website with well-woman periodic assessment recommendations. In the past, the organization offered the periodic assessments in written form, with the most recent publication being in 2011, Committee Opinion Number 483. Now the information is up to date and offered electronically. The organization states that annual assessments provide an excellent opportunity to counsel patients about preventative care and to provide services. The assessments include screening, laboratory, evaluation and counseling, and immunizations. They are based on age and risk factors and should serve as a framework for your care. This is an example of ACOG's periodic assessment for ages 13 to 18 years from Committee Opinion Number 483. The next age group is women aged 19 to 39 years. Here we have the assessment for women aged 40 to 64 years. And lastly, we have the assessment for women aged 65 years and older.